You must have seen this crash cart hundreds of times in ER. We all know that all the emergency drugs are kept there. But do you really know what are the 5 most important emergency drugs that can help you out in emergency? Hi, I am Dr. Saurabh and I am working as a consultant in critical care since 15 years. Today I am going to tell you 5 most important emergency drugs that every MBBS student, intern or a young doctor must be confident of using in emergency. Here I am just not going to tell you the names, but I am also going to tell you the indications, the doses, the formulations and also the real world tips so that you do not freeze while using them in emergency. So let's get started. So the first drug and the most important drug in our list is adrenaline, which is also called as epinephrine. So what are the indications? Its indications are: first is anaphylaxis or anaphylactic shock. Its second important indication is cardiac arrest. This is the drug that is drug of choice in cardiac arrest. So what are the doses? When we use this drug in anaphylaxis, the dose is 0.5 milligram intramuscular. This is the dose that is given in anaphylaxis, and the dilution of this dose is 1:1000. When we use this drug in cardiac arrest, the dose is 1 milligram intravenous, and this dose is repeated every 3 to 5 minutes till we get the response, and the dilution is 1:10,000. An important tip here is that you must be able to use the proper dilution. You can see that when we give this drug intramuscular, the dilution is 1:1000, and when we use this drug in IV by IV route, the dilution is 1:10,000. Now how this drug is available? This drug is available as a 1 ml ampule, and in each ml there is 1 milligram of drug. So the concentration of drug is 1 milligram per ml. So this was our first drug, that is adrenaline. The second most important drug that is used in emergency is atropine. Its 2 most important indications are: first, it is used in bradycardia, and second indication, it is used in OP poisoning. So what are the doses? So when this drug is used in bradycardia, the dose is 0.6 milligram IV, and this can be repeated every 3 to 5 minutes, and maximum dose that you can give is 3 milligrams. When we use this drug in organophosphorus poisoning, you have to give around 2 to 5 milligram IV as a bolus, and then you have to repeat this drug till the secretions are dry. In OP poisoning, we have to use this drug in lot of quantity. What are the most important tips here? The most important tip is that you have to monitor something. What you have to monitor? You have to monitor the heart rate, because this atropine drug is known to cause tachycardia, that is increase in the heart rate. Second, you have to monitor is the size of the pupil. This you have to monitor. Now how this drug is available? This drug is also available in 1 ml of ampule, and the concentration or the drug dose available in 1 ml is 0.6 milligram. But this atropine is also available as 100 ml of vial. We all know that in organophosphorus poisoning, we have to use a lot of this drug. So if we take 1 ml of ampule, then we need to break lot of ampules. So instead of that, if we have this 100 ml of vial, then we can easily take drug from the vial and give to the patient. So this was atropine. Now the third important drug again starts from A, and this is amiodarone. What is amiodarone? It is an anti-arrhythmic drug. This drug is also a broad spectrum anti-arrhythmics. You must have heard this name, broad spectrum, in relation to antibiotics. But this Amiodarone is a broad spectrum antiarrhythmics, and its indications are, it is mostly used in ventricular tachycardias and ventricular fibrillation, and most importantly those tachycardias that are resistant to shock resistant, means VT and VF that are resistant to shock, that can respond to Amiodarone. Secondly, this Amiodarone is also used in supraventricular tachycardias. Now what is the dose? We give this drug as 150 to 300 milligram bolus, and then we give it by infusion, generally 600 to 900 milligram over 24 hours. What is the important tip here? You have to monitor two things. First is the BP, because this drug is known to cause hypotension. Second thing, you have to see if there is a QT prolongation. These are the two important things that you have to monitor when you give Amiodarone. So how this drug is available? This drug is available as a 3 ml ampule. 3 ml ampule, and in 3 ml of ampule we get 150 milligram of Amiodarone. So this was Amiodarone. Then the fourth drug is Midazolam. Midazolam is what? It is a benzodiazepine, and its indications are, two important indications are, it is used in seizures, mostly status epilepticus, and it is also used for giving sedation. Now what is the dose? The dose is generally 2 to 5 milligrams. This can be given IV, or it can be also given by another route, that is intramuscular or buccal route, and then here the dose is 0.2 milligram per kg. The dose is decided according to the weight of the patient. So what is the important thing that you have to monitor? You have to monitor patient's respiration, because there can be respiratory depression in this case, and you have to also monitor the patient airway. When the patient gets sedated, the tongue may fall and there may be an airway obstruction. So you have to monitor two things. First is respiration and another is airway. So how this drug is available? It is available as a ampule. There is 5 milligram in each ml. So this is the ampule can be of 1 ml or it can be of 3 ml or so. And this drug is also available as a vial. In vial, there is the concentration of drug in vial is 1 milligram per ml. 10 ml vial or 5 ml vial is also available. So this is Midazolam. Now the last drug but not the least is Dextrose 25% or 50%. What are its indication? Its most important indication is hypoglycemia. When the blood sugar comes down really low, then there is a risk to the patient's life, and in that case we give this Dextrose, and its dose is 25 to 50 ml IV push. Most important tip is we have to see patient's sugar after giving this drug. Sometimes patient's hypoglycemia is not corrected by this much of dose, and in that case you may have to repeat the dose. How it is available? Most commonly this 25% dextrose is available as a 100 ml vial, and 50% dextrose is available as a 25 ml ampule. So in summary, these are the 5 drugs that are most important and that we use in emergency. First is adrenaline, and its indications are anaphylaxis and cardiac arrest. Second is atropine, that its indications are bradycardia and OP poisoning. Then third is amiodarone. It is used in supraventricular tachycardias, ventricular tachycardias, ventricular fibrillations, and mainly those that are resistant to shock. Then midazolam, it is used in seizures and for sedation. And the last drug, that is dextrose, is used for hypoglycemia. So these are the most important 5 drugs that you will really look for in emergency. So friends, if you find this information useful, then please give a like to this video and do share with your batchmates. And if you have not subscribed to this channel, then do subscribe for a weekly clinical dose. So see you in the next video. Till then, thank you.